We all have stress, but how exactly do you deal with that stress? Some stress is good and some is bad. The kind of stress that makes you excited about the future and that you're fulfilling your life's purpose is good stress. The stress of being debilitated and hating your spouse and hating your job and having no real purpose for your life is bad stress. But sometimes patients think that their negative stress is positive stress. So it's a whole psychology thing, and you have to be able to take a step back and make an objective decision for yourself as the person who is struggling with an autoimmune disease what bucket your stress falls into. The bottom line of stress is that it increases something called IL 17. IL 17 then drives something called TH17. And TH17 is what promotes the inflammatory cascade associated with autoimmunity. But once again, talking about good stress versus bad stress, there is some stress, good stress, that turns on opioids, and opioids in return combat the inflammatory cascade that's associated with autoimmunity. You know, some people, they love what they do. They love to work on their business or putting in 80-hour work weeks. And if you have them stop that, their autoimmunity will then flare. We all need some degree of stress in our lives, some problem that we can overcome. The dilemma is that when we take on stressors that we are not able to conquer, if you're constantly placed in a stressful situation and you always come out victorious on the other side, that's what I would consider positive stress, which not only has the beneficial opioid response, but also the positive reinforcement of going into the storm and coming out the other side. That's the same attitude that you need to have when it comes to managing an autoimmune disease. There will be times when you have a flare, but if you have so much evidence from the past of being put in difficult situations and coming out on top, you can fall on that experience to say, this is just another situation that I'm going to overcome. Now, we also have to be able to have a firm grasp on reality and understand where your ceiling is so you don't end up biting off more than you can chew and then being placed on this downward spiral of continuous shortcomings. When it comes to managing stress, something that I personally do and highly recommend is to take one day a week as a day where you have no responsibilities. For example, for me, I love being outside in nature and trying new food. And so every Sunday, a few friends and I will go and spend a few hours on a hike. And then we try to find a restaurant that we've never been to. And I'll go home and then take a nap or read a book or watch TV. And I do not respond to emails. I don't answer phone calls. Unless you're family or a friend, I'm probably not going to talk to you on that day. And you know what that does? No matter how hard your week was, at least you now have one day to look forward to. Do not contaminate that day with any errands or responsibilities. Use that day to do whatever it is that you want to do, whatever you enjoy doing. And if you can't do a full day, do a half day, but a full day would be ideal. Also, if stress seems to be your biggest trigger, I'd encourage you to check out the guide that I made on how to manage stress. I'll leave the link below.